For people suffering from joint pain, surgery is not always the next step. Dr. Matthew Kanaan is a Duke-trained physician specializing solely in non-surgical treatments for pain relief, and he joins us now to talk about how we can benefit from medical advancements in this field. Doctor, thank you so much for joining us.
I'm happy to be here.
Okay, I think a lot of people's ears perked up because when they are hurting and know something needs to be fixed, surgery can be scary.
Yeah.
So to have the option to not have to have surgery sounds really great. Tell us about your practice.
Yeah, so my practice focuses kind of on the middle ground between physical therapy and surgery. And so we really try and think outside the box to think of treatments and to come up with treatments that have some studies to keep people out of surgery, or at least just to delay surgery a little while.
Which is always a good thing.
Yeah.
I know that the medical field has just been so forward-thinking, and the advancements are coming so quickly. You have two alternative procedures that can be done that a lot of people may not have heard of. Tell us what you do.
Yeah, so what we focus on is what we call orthobiologics. And what that is natural substances as opposed to steroid, like sugar, derivatives, hyaluronic acid, which they put in the face for plastic surgery. We actually inject those into joints. We also use cell therapies like the blood, or we use fat, or we use bone marrow. And we use those to treat orthopedic issues, and so we kind of consider that orthobiologics. And then we use some treatments called regenerative therapies, which orthobiologics falls under, but other things would be like shockwave therapy, which physical therapy uses, and we're using more in orthopedics to treat tendonitis and to treat issues with injuries that people have that just aren't getting better.
I think a lot of people have probably heard of some of these treatments when it comes to like your face and beauty treatment.
Right.
So it only makes sense that you would use these for actual joint and bigger issues.
Yeah.
Who's a good candidate for these procedures? Yeah,
since it's your own blood, I mean, most people are good candidates for these procedures. People that have bleeding disorders or blood cancers are not necessarily candidates for it. But, I inject patients in high school. We treat patients that are over 100 with platelet procedures. And since we're using your own blood, it's very safe. There's not a lot of side effects. Like you said, plastic surgeons use platelet procedures, dentists, veterinarians use it in animals and horses. And so in orthopedics, within the last 5 years or so, it's really exploded the number of studies that really support using blood versus steroids or anything like that. And what we found is that the platelet procedures can actually delay surgery sometimes for these patients.
I can only imagine. I think this is so fascinating because many years ago I started school to be a vet.
Yeah. And
this was not an option. It was just kind of getting into some of the research that's being done. I bet you're seeing results that are just phenomenal.
Yeah, I think it's interesting. A lot of my patients do well with the PRP procedures. We also do a procedure called MFAT, where we take a mini liposuction and take the adipose tissue to inject into joints. And I would say probably 80 to 90% of my patients get some relief out of these things, and sometimes substantial relief. It's horrible that a lot of insurance companies won't cover these procedures yet, because I think if you just compare the studies, it's better than steroid, right? Steroids can be harmful, but these procedures are very natural and very safe. And I think as a whole, just a better procedure for patients.
And we're all looking for comfort, and maybe even an ease of healing is probably, I'm guessing the downtime, you're not going to have to be out of the office so long. It's not going to be cuts and stitches and all the things. Right.
With professional athletes, this is where it kind of started. And so if you kind of look at any professional sport like basketball or football or soccer, a lot of these athletes are getting PRP the next day or the week after, and that's for a reason. We want to get them back as soon as possible, and so why not apply that to people like you and me who just want to run more, play golf more, play tennis, and so this has really helped a lot of my patients just get back to what they like doing. Without all the side effects of some of the other treatments.
This makes so much sense. And I think another perk to this is you don't actually have to go to a hospital to have the procedure done.
Right. Yeah, most of this is done in our office, or all of it is done in our office. Patients come in, we'll draw their blood, we'll do the mini liposuction procedure in the office, shockwave procedures. So they drive themselves. They may a day or two afterwards where they're off work, but then they're back pretty soon, so they're not out of work for weeks. And so most patients tolerate this very well, and it's just a very easy procedure for most patients.
I wish we had so much more time to talk about this because I have so many questions for you. Like I'm sure so many people at home who are hurting and looking for relief do as well. How can they get a hold of you and maybe set up that consultation?
Yeah, so they could go to the website, Carolina Nonsurgical Ortho.com. There's lots of on there, lots of studies, and we have several ways to schedule and get a hold of us.
Well, we appreciate you being here today. Thank you so much, Doctor.
Yes, thank you.
The preceding was sponsored by